Hemochromatosis. Hemochromatosis is a disease where there is a lot of iron absorption in the GIT. It is a condition in which the amount of total body iron is increased, that is high. The excess iron is deposited in and causes damage to several organs, one of which is liver. It's not like hemochromatosis affects only the liver, it affects a lot of other organs. Liver is one among them. Treatment, the main treatment consists of venesection phlebotomy of 500 ml blood until the serum iron is normal. So what we are doing is we are taking out all the blood from the person. That's the main treatment. Second treatment is the iron chelating agent desferrioxamine is used. It's either given IV or subcutaneously, and that is as an adjuvant therapy. And then comes an oral iron chelator, deferripone. Deferrasirox is new drug. Okay, so that was about the treatment. The treatment includes the venesection, venesection phlebotomy, weekly venesection phlebotomy of approximately half a liter of blood. Second is desferrioxamine. Third is deferripone. And then comes the clinical features. So, features of hepatic cirrhosis will be there. The person may have hepatomegaly, meaning big liver, diabetes mellitus, arrhythmias. The triad of cirrhosis, skin pigmentation, diabetes mellitus will be seen. So, the person with a lot of iron will be diabetic. Leaden grey skin pigmentation is due to excess of melanin and iron occurs, especially in the exposed parts, bronzed diabetes. Leaden grey skin pigmentation due to excess melanin and iron occurs, especially in exposed parts, bronzed diabetes. Impotence, loss of libido, testicular atrophy. These changes are primarily the result of decreased production of gonadotropins due to impairment of the hypothalamic pituitary function by the iron deposition. Arthritis with chondrocalcinosis secondary to calcium pyrophosphate deposition is pseudogout. Joints of hands, especially second and third MCP, are first to be involved. Impotence, libido, loss of libido, testicular atrophy, leaden grey skin pigmentation due to excess of melanin, that is bronze diabetes, arthritis. These are all the most common clinical features. Images of hemochromatosis will include hemochromatosis overall. By and large, there is bronze diabetes, which is nothing but the person is diabetic along with the leaden grey pigmentation. It's leaden. It's Leaden, leaden. Characteristic arthropathy is seen in the second and the third MCP joint, metacarpophalangeal joint. Hemochromatosis seen in the Prussian blue stain. MCP joints in hemochromatosis is hooked or beak-like overhanging osteophytes. So osteophytes are seen in case of this disease. Affected patients are at risk of increased infection with Vibrio vulnificus, Listeria monocytogenes, Yersinia enterocolitica, and other siderophilin organisms, which are nothing but iron-loving organisms. The risk of porphyria cutanea tarda is high. Most common cause of death in treated patient is hepatoma, meaning a benign liver tumor. Most common cause of death in an untreated patient is congestive hepatic failure. CHF. Congestive heart failure, right? Yeah. So the phenotype means manifested physical features like increased slate pigmentation of the genome. Okay. Investigations of hemochromatosis. The serum ferritin is greatly increased. The plasma iron is also increased. High transferrin saturation. Transferrin saturation is nothing but the ratio between serum iron and TIBC. So iron is on the top, TIBC in the bottom. The transferrin saturation is more than 45%. If it is more than 45%, is the earliest biochemical marker. Okay. The diagnosis is confirmed by liver biopsy. It shows heavy iron deposition and hepatic fibrosis, which may have progressed to cirrhosis. Iron content of the liver can be measured directly as well, if indicated. Etiology, the gene is located on chromosome number 6. It's an autosomal recessive condition. Approximately 90% of the patients have a single mutation, HFE gene at position C28-2Y, H63D, and a protein HFE. That is about it. Desferrioxamine is the treatment.